Good afternoon, everyone. My name is Alicia Dillard, and I will be going over the supervisor training for Department of Transportation drug and alcohol testing programs. There are 5 panels of drugs and alcohol that are tested for Department of Transportation testing programs. In 49 CFR Part 40, Subpart F, the DOT states drug tests are require laboratory testing for 5 classes of drugs, which are as follows: marijuana, cocaine, opiates, and amphetamines and methamphetamines and phencyclidine, better known as PCP. The first class of drug that I will be going over is marijuana. I've included a table showing you the initial test cutoff, the conformity test analyte, and the confirmatory test cutoff concentration. All safety sensitive employees are required to take a drug test prior to starting a job, um, after they have an accident or cause someone else to get hurt, they have to take a test. Also, if they're randomly selected, they have to take a test. And last but not least, if they are reasonably suspected of using any kind of drug on the job, they have to be tested as well. Clear indicators of marijuana use are delayed decision making, hyperactive red eyes, which is like the number one indicator, uh, and distinctive odor on clothing, which marijuana tends to have a strong scent, so it's very hard to mask the scent if someone is using marijuana, especially on a job. Slow speech is another indicator that might show that someone is also using marijuana. The next class of drug I will be going over is cocaine. I also included another table with the initial test cutoff, the conformity test analyte, the confirmatory test cutoff concentration. Unlike some of the other drug classes, cocaine tend to cocaine tend to clear your system a lot faster than the other ones. Like if you're doing a blood or saliva test, it only shows up to 2 days. If you're doing a urine test, it should be out your system within 3 days. Clear indicators of cocaine use are erratic mood swings, paranoia, increased physical activity and fatigue, restlessness, runny or irritated nose. Now, mind you, it's cold season, it's flu season, sinus season. So it's a lot of people with runny and irritated nose. That does not mean they are using cocaine. So that is not a reasonable suspicion to have someone tested because they're blowing a nose. But this is one of the indicators that they may be using cocaine. We have opiates. These are a little tricky because they are legal and illegal. And also, they can be prescribed by a licensed physician. Say if you get in an accident or you have a very serious injury, a doctor or your doctor may prescribe you opiates to help you cope with the pain. Heroin is an illegal opiate and cannot be prescribed by a licensed physician. Some indicators of opiate use is loss of balance, depression and apathy, tiredness, dilated pupils, and slurred speech. The next drug class I will be going over is amphetamine and methamphetamine. Amphetamine, also known as speed, can be taken orally by mouth. Methamphetamine, also known as meth or crank, may be taken orally, injected, and can even be snorted. Clear indicators of amphetamine and methamphetamine use are hyperexcitability, dilated pupils, confusion, and panic. The next drug class I will be going over is phencyclidine, known as PCP. It's also known as angel dust. This drug can be used as a depressant, a hallucinogen, and also act as a stimulant. Clear indicators of PCP use is impaired coordination, extreme mood swings, dilated pupils, agitation, and profuse sweating. Lastly, we'll be going over alcohol. Alcohol is one of those ones that are legally, you can purchase legally in your state if you are of legal age, and but it's prohibited to use at work in a workplace. It's prohibited. You can purchase it if you have legal age, and it's prohibited to use at work. Employees must not report for duty to perform safety sensitive functions while having a blood alcohol of 0.04% or greater. Some signs of alcohol use are slurred speech, staggering walking, exaggerated behavior, lack of coordination, and the smell of alcohol, which, like marijuana, is very strong, is very easily to detect if someone has been drinking on a job. It's just one of those things that's kind of easily to detect. So, in conclusion, um, a positive drug test result and alcohol concentration of 0.04 or more, or a refusal requires a safety sensitive employee to be immediately removed from their position. The employee must provide the employee with a list of acceptable SAPs from which to choose to begin the return to duty process. An employee cannot legally return to work. A DOT safety sensitive employee cannot legally return to work until they complete a return to duty process. The Department of Transportation mission is to ensure that drug and alcohol testing policies and procedures of the Secretary of Transportation are developed and carried out for the ultimate safety and protection of the traveling public. If you need any additional information, you can go to the website below at www.transportation.gov/ODAPC/employee. You'll be able to find as much more information as you might need. I thank you all for your time. I hope you all enjoyed the presentation. Have a blessed day.